Quickly, medical tourism involves, like we all know, patients intentionally leaving their home country to access non-emergency healthcare services abroad. Growth in the popularity of this practice has resulted in a significant amount of attention being given to it from researchers, policymakers, and the media. Yet, there has been little effort to systemically synthesize what is known about the effects of this phenomenon. Now, given its positive and negative effects on the healthcare systems of departure and destination countries, medical tourism is a highly significant and contested phenomenon globally. This is especially true given its potential to serve as a powerful force for the inequitable delivery of healthcare services globally. It is recommended that empirical evidence and other data associated with medical tourism be subjected to clear and coherent definitions, including reports focused on the flow of medical tourists and surgery success rates. Additionally, primary research on the effects of medical tourism is needed if the industry is to develop in a manner that is beneficial, to citizens of both departure and destination countries. Those are my views. Okay, I'm going to narrow those trends into four trends, but globally speaking, like we all know, medical tourism is a multi-billion-dollar industry that is set to grow to 25% every year for the next 10 years. Statistically proven. This shows that more people are becoming interested, no doubt, to combine the pleasure of traveling with the benefits of medical advancement. So what, for me, are those top trends, to look forward to? Number one, the growth of private health cities. Foreign investment has grown significantly. This paved the way for private health cities to emerge. From, patients from different countries are becoming attracted to multi-specialty hospitals. These hospitals offer both health and hospitality, which is very, very key. Then we need to, in looking at those trends, we can't shy away from the second trend for me, which is the Asian expansion, especially India. Medical tourists bound for Asia are expected to increase in number because Asian countries provide high standards of hospitality and care. Plus, they are always updating to the latest technology. And don't forget that medical care is a lot cheaper in Asia than other regions, especially, like I said, in India. I think the close country to India right now will be Thailand, Then three, the cultivation of skilled medical tourism professionals. The growth of the industry calls for a surge of qualified healthcare personnel. This includes doctors, surgeons, translators, physiotherapists, and other facilitators. Medical schools and training centers, are also expected to rise with the need as these professionals learn specialized procedures that are favored by medical tourists. These are, rhinoplasty, angioplasty, and breast augmentation, among others. Then the fourth, for me, in that trend is the establishment of new destinations. Several countries that are known for catering to medical tourists will have new contenders in the future. The United Arab Emirates, Greece, Taiwan, they've shown, promising growth over the past years, in part due to their breathtaking landscapes that patients look forward to during their visits. Medical tourism has indeed changed the future of the healthcare industry. It has expanded so much and is continually evolving all through the globe. The previously set standards are said to be surpassed in the coming years as more people will expect for more advancements, quality service, as well as lowering of the cost. So those are those trends that we should be looking forward to. Yeah, my take on that very briefly, really, it's if we look at the advantages to the medical practitioners as compared to the patients, it's quite minimal because oftentimes the physician is a brand. So it gives an opportunity for the practitioner to reach out to those people who are even unaware of his skills, his specialties, and so on. Also, it assists the practitioner to understand new diseases and also emerging trends in those localities. Basically, those are just, and the exposure, which is very, very important. Yeah, medical tourism can be risky, for me, and it comes with a lot of challenges. the risk of complications depends on the destination, the facility where the procedure is being performed, and whether you are in the good physical or psychological condition for the procedure. Other issues that can increase your risk of complications include infectious diseases. All medical procedures have some risk of complications. Those associated with procedure done in other countries include wound infections, bloodstream infections, donor-derived infections, and diseases such as hepatitis B, hepatitis C, and HIV. Now, you also have the risk of antibiotic resistance. Antibiotic resistance is definitely a concern and a global problem. However, you are more likely to get an antibiotic resistant infection in some countries, especially in African countries or some parts of Asia. Highly drug resistant bacteria have caused infectious disease outbreaks among medical tourists, no doubt. Then the quality of care. Some countries' requirements for maintaining, licensure, credentialing, and accreditation may also be less than what would be expected in countries like United States, UK, Germany, and so on. In some countries, counterfeit medicines and lower quality medical devices may be used, which is true, especially in Africa. Communication challenges. Communicating with staff at the destination and healthcare facility may be challenging. In Nigeria, we have like a Turkish hospital, which of course communication has always been a barrier. Receiving care at a facility where you do not speak the language fluently could lead to misunderstandings about your care. Basically, also air travel. Flying after surgery oftentimes can increase the risk for blood clots. If you get chest or abdominal surgery, for example, you do not need and do not travel by air for at least 10 days to avoid risk associated with changes in atmospheric pressure. People who get cosmetic procedures of the face, eyelids, or nose, and who have their laser treatment should wait at least 7 to 10 days before flying. Now, the basic and the most fundamental of them all, of those risks, is the continuity of care. It is not enough to seek medical care abroad, but what about post-care? So you may need to get healthcare in the country if you have complications after returning. So those are the major risks that I've lately seen. Well, the journey for us has been so challenging, interesting, and so much fun. Because we are operating in an environment where medevac travel is still at its infancy. A lot of people are not aware. A lot of people don't really understand what they need to do, and basically, it's been a very, very tough thing. Now, we also have traditional values affecting travels, especially in decision making. So oftentimes you have situations where you have a patient and you need to travel ASAP, when the family decision to allow the person to travel takes time. Then the patients move from stable situation to unstable situation. So far, we say those are the complex issues, and also the economy. For example, the exchange rate to the dollar, because aviation is dollar denominated, and also the banking regulations affects, the ease of business, especially in medevac travels. For us, it's been interesting, nevertheless. Then, and I think we'll keep at it. Perseverance is very key in business. So, we'll continue to persevere and explore opportunities and synergy with international partners and operators. Yeah, my motivation started from an unfortunate scenario where we had a cardiac patient who is like a family member, and we needed to travel just within Nigeria to move him on a stretcher aircraft. And I discovered that there wasn't any, in the whole of the country. So what I now did is, contacted my friends in Dubai, came to Dubai, had a little of meetings, and it was amazing how fast and acceptable it was for them. And we had sign up. So what we try to do right now is to broker, air flights from Nigeria to any part of the world, and build synergy with also destination hospitals as well. So both in referral and also both in medevac referral for both sides. Now, and I got motivated because oftentimes a lot of, high net worth patients pass on because they don't have direct access to medevac services to take them to London, Cairo, and the likes. And also saving lives became a passion for me, and I followed my religious injunction that who saves the lives is as if you have saved mankind, and if you destroy a life, it's as if you have destroyed mankind. So saving lives became a passion for me, and having evolved from a medical home as well, then I felt this is something I needed to do and embrace. Now, what's the future in a couple of years? Yes, we are open because currently we operate with partners in Luxembourg, in Turkey, United Arab Emirates, and in Malta. So what it is that the cost of airspace in Nigeria is very expensive. So to park an aircraft in Nigeria is really expensive, except if you have a partner who is willing to also have the aircraft basically on ground in our locality. Then we can actually seek for an hangar, for a hangar in one of the airports, which may eventually become cheaper for us to airlift patients from the capital city to the economic centers of within interstate travels. So, but for now, we're hoping that we'll be able to grow our company, into a large fleet. For us, we are tenacious. And like we said, we always follow the model of Lloyd's of London. You remember Lloyd's of London in insurance. We started from a coffee shop. So we don't expect success all the time. We lose because of understanding of cancellation policies, and change, in the condition of the patient. So we see us, moving right ahead and expanding over the next few years, with extreme focus. Yeah, education is really important, and also thank God sometimes the COVID-19 and web, has brought us to an idea of how to grow, organizations, destination. For example, in medical tourism, for example, organizing a webinar, rather than the doctors, coming around and so on. So that gives visibility to organizations. Medical tourism, there's a lot of misconception about medical tourism in Nigeria. Now, medical tourism in Nigeria, from the medical perspective, is such that, like we always say, there's medical tourism outbound, and there's medical tourism inbound. Currently, what we have more here is medical tourism outbound. So that will continue to grow unless we continue to give education about medical tourism. And it's a thriving industry, whether we like it or not. And there's no legislation that stops anybody from moving from one country to the other to seek proper medical care. It's your constitutional right to seek for, excellent medical. Yeah, the countries, basically from my own local market statistics, the India actually forms the largest percentage, which is about 60% of those who travel. And it's an amazing figure, because if you look at the population size of the country, is about 200 million as of today. And what we'll be thinking about is who are those people that spend about 2.5 billion US dollars in medical tourism? Just about 30,000 people. You can imagine 30,000 people out of 200 million. That's a far cry, And the question is, why is it always India? Number one, expertise. Number two, cost. Number three, ease of movement also. The only challenging thing with India destination, which I think the embassy here promotes, is the visa, quick visa. So we think that a lot of destination hospitals should also have synergy with their local embassies here, so that they can facilitate quick visa, approval for patients to come. After India, you'll be talking about other traditional locations like Cairo. Cairo happens to be another good destination. Sudan is another. Then Dubai, UAE. UAE seems to be one of the easiest places to travel to, especially even for us in the medevac services, when the patient doesn't have a visa to their proposed countries like UK or United States. So we advise them to just do United Arab Emirates, because within 24 hours, maximum 48 hours, we can get them their visa, and we will fly them quickly to save their life before they can get stabilized and move to the other destinations. Now, with new investments and focus on healthcare systems on the continent in the long term, will Africans choose to stay within their country? The answer is yes. Or go to neighboring countries rather than travel further afield. The answer for me is yes. Now, the COVID-19 has brought out a new philosophy, a new idea of which we are also promoting, and we're also seeking for partners, which is called reverse medical tourism. It's amazing. A lot of Indian companies are investing massively in the Nigerian local market, partnering with local hospitals in terms of human capital, and also in terms of direct investments, buying over hospitals, or having partnership, or making concessionary involvement with some hospitals, like that. And I think that's a trend, because if we look at it very well, what about 50 million Nigerians that they have the ability to travel, but because of complacency, because of the fact that their job will not permit, they don't want to travel. So for me, it's a gold mine. The Turkish hospital and Premos, which is also they make humongous amounts of money that obviously you start thinking, why don't you just locate? Then the regulations, it's always good to have a local partner, to take care of the political side of your business. Which happens in almost every country in any case. So for me, I think reverse medical tourism is the major thing happening right now. And that's because of COVID. So we prefer when specialist doctors come into Nigeria, do surgery, the local ones oversee them, they make their money, they go back. So that will continue to evolve, whether we like it or not. Yeah, the COVID-19 pandemic impacted tourist business on a global scale dramatically, even the normal tourist business. The medical tourism always, was considered as the most stable and the least subjected to external circumstances. However, spreading of the coronavirus infection shortened both number of arrivals and the volume of medical services provided within the framework of their expo. National lockdowns and restrictions and international travel bans decimated the global tourism industry last year. And it's still ongoing now. Medical tourism was one of the segments most gravely affected by this. There were cases where even when you could travel without travel restrictions, ICU beds were occupied, so you could not even make any headway. However, while it takes some time to get back to the level seen before the pandemic, various institutions around the world are implementing measures intended to reboot the industry in their respective countries. Alongside such measures is telemedicine, for example. Telemedicine is also seeing considerable growth, with many hospitals expanding their offering of online pre-travel diagnosis and post-travel consultation. While solutions do not capture as much value as an actual visit, they serve to maintain contact with the potential clients. And that's the amazing thing with my own local industry, because the telemedicine, you interface with the patient, whether via WhatsApp or Zoom or something, it gives them a lot of amazing satisfaction. It's at no cost to them, but then it gives them the zeal and the opportunity. Once the borders open, they still want to, because no matter the telemedicine you do, it cannot equate to their physical, appearance. So global medical tourism undoubtedly took a hit in 2020 due to the coronavirus pandemic. Nevertheless, as a recent positive performance of destinations such as Dubai suggests, implementing a combination of solutions can help to restore the confidence of medical travelers, which should be the first step on the road to recovery. Thank you.